For centuries, the tobacco's been used. There has never been a regulation, and now FDA has the power to regulate tobacco and tobacco products. But it's not clear what could be regulated.
They need more science to support the things that need to be regulated. And it decided that a very important way to do that would be to fund centers who would think about the science they did in terms of what would be appropriate to support that regulatory effort. The American Heart Association Center is looking at quite specific things to help the FDA.
We call it A-TRAC, and part of what we are doing will provide guidance to the FDA in which particular components of tobacco use or the harm or the appeal could be regulated to minimize the burden of tobacco-induced disease in our society, not just in the United States, but the rest of the world as well.
Within A-TRAC, we have a number of the best universities and best investigators in the world working on tobacco-related research.
We all know for several decades that smoking is injurious for cardiovascular health, but we don't know why and how. I am looking to identify the early, sensitive, and robust markers of cardiovascular toxicity, which correlate with the exposures. And once we identify these markers of cardiovascular toxicity or injury, they can be validated in the cross-sectional or prospective human studies. And by doing this detailed and systematic studies, we should be able to dissect out the active constituents of tobacco products and the emerging tobacco products like electronic cigarettes, which cause the cardiovascular toxicity.
It's really important to understand the mechanism by which smoking causes cardiovascular injury. Project 2 from A-TRAC looks at biomarkers of both exposure and subclinical cardiovascular injury relative to tobacco exposure. We work with the multi-ethnic study of atherosclerosis, which is one of the most phenotyped prospective cohort studies in the world, including measures of subclinical vascular injury, imaging markers, and serum biomarkers. So we are looking at which of those markers of subclinical vascular injury are most highly correlated with smoking. Because if we know that, we can then look later at other biomarkers, let's say, of tobacco exposure, and see if those correlate with these measures of subclinical injury that we know are most associated with smoking. I think the most interesting thing is moving smoking research into the modern era of imaging. So we can actually look at the behavior of blood vessels with, for example, imaging tests and see how smoking affects those measures. And that's not something that was possible, let's say, a couple decades ago.
The level of enthusiasm and the support for the ultimate goals that we're trying to achieve here has been just astounding from my perspective. In Project 3, what we're doing is trying to get a better understanding of how people think about tobacco use, what the risks associated with it are, and things we might be able to do to develop a better campaign to encourage people to seek evidence-based treatments to quit. As of right now, lots of people use tobacco, obviously, and use a variety of methods to quit, but very, very few use the resources that have been developed to specifically assist with that. So the point here is to improve the media messaging in such a way that will encourage people to take advantage of those resources.
It's very critical and important research. There are about 1 billion people in the world that smoke today. And there is projections from WHO that if we eliminate all tobacco, then from now to the end of the century, we will save over 1 billion lives.
I think the team we have with our A-TRAC, led by the American Heart Association, is really just a stellar group. We're running the gamut from basic science to community and based kind of work. It's a really not only innovative, but from a health perspective, so important to our country at this point.
The American Heart Association has as its mission building healthier lives free of cardiovascular diseases and stroke. Tobacco is one of the most important risk factors for developing problems with cardiovascular diseases, for developing heart attacks and strokes. So if we can reduce tobacco use and help people understand why they shouldn't smoke, that will make an enormous difference in how much we can create a healthy population.